natural result possible. So they ask us, what do we do to make sure that they really get a natural result?
So two different things that you want to look at. The first place to start is aesthetically. We think it's impossible not to do computer imaging. It's a really important conversation because what you think is natural might be really refined and straight and sharp, and another patient might want just exactly the opposite as what they define as really natural. They want round, sort of a little bit of a break. Whatever that conversation is and what natural is to you, that has to be established between you and the surgeon.
And that's really only something you can do with not just conversation but imaging. What's really important to differentiate is when we say natural, sometimes people associate that with minimal change. And it doesn't mean that at all. In our case, what we look at is what's natural for your face. The nose should just balance so well with your other features that we like to say it feels like the nose you always had. And for some people that may be a really dramatic change, big bump going away, a really droopy tip coming up. For some people it's relatively finesse type of changes, but it's all about getting to that place where the nose just fits.
Yeah, that's a really wonderful thing that we always talk to patients about. That's why we've sort of made this a career centerpiece for us. When the nose fits, it's really this magical thing. It kind of fades away and we see the things that animate your eyes, your smile, the face as a whole. And when it doesn't, if it's got a bump, if it's crooked, if there's something wrong, if it's overly scooped or whatever the problem is, it's the center of your face, so we notice it. So the first thing aesthetically is make sure that you and the surgeon are on the same place with that. The second thing is really technical. For us, that means an open rhinoplasty, essentially almost anytime you're dealing with tip work but of any sort. And that has a lot to do with the fact that we don't believe in reductive procedures.
The technique for us really has to do with changing the cartilage by using primarily stitches to draw the cartilage, especially at the tip, into the shape that we want. And that doesn't allow us to cut away a lot of cartilage and reduce support for the nose. Once we have the shape we want, we then can anchor the tip in place to that hard septum behind it. So we set the angle of the tip exactly where we want. We can set the narrowing and definition exactly where we want. We can both see right there on the operating table exactly what a patient's going to be left with, and we're not left guessing and hoping that it's going to heal the way you hope.
So two important conversations to have. One, aesthetically, make sure you and the surgeon are on the same page. And then two, once the aesthetic is established, how is he going to get you there? What are the techniques he's going to use?